know that it's normal and it's common for new parents to be tired, for babies to not sleep through the night. The ones that actually do just naturally sleep through the night, we call those unicorn babies. And at the most, you're only allowed to have one of those, if at all, usually not at all. So sleep training can mean a lot of things to people. Generally, we don't recommend sleep training before a baby is 4 to 6 months of age, just because they might not be developmentally ready before that. And I think my favorite piece of advice actually starts from day one. An awesome habit you can start right away is putting baby to bed while he or she is drowsy but awake. That's key. So they might not love this. They're probably going to hate it in the beginning, realistically, but it's really good practice to help them learn how to self-soothe. I love bedtime routines. And as a toddler mom myself, I can vouch for the usefulness of this for years to come. I think that having a consistent and predictable routine before bed really helps your baby wind down, and it signals to them that, hey, it's time for that daily transition. That could mean a bath followed by a book, then a song, then bedtime. So camping out is where you stay in the baby's room and you gradually move further and further away, and you minimize the support you're giving them as they're getting settled. So for instance, you might start off sitting next to baby the first night. Then you start reducing how much you pet your baby. And then the next night you might sit in a chair a short distance away from the crib. Then you might move it gradually towards the doorway and eventually outside of the room. So in this scenario, you start leaving the room for gradually longer and longer periods of time until ultimately your little kiddo is actually asleep. So during the drill, a parent might say something like, "Oh, excuse me, I might need to step out and XYZ, I need to go grab a cup of coffee at 3 a.m. because I need a cup of coffee at 3 a.m. or whatever." And then you say, "I'll be gone for just a couple of minutes and then I'll be right back." This method tends to work better for older infants and toddlers, but a lot of people have tried it for younger ones, and it seems to be pretty effective for younger age groups too. As a physician, the only advice that I can really give is what the studies show, which is pretty much that there's no wrong way of doing things. Like, your kid will ultimately learn how to sleep. And if you decide to sleep train once they're at least 4 to 6 months of age, you're not going to traumatize your kiddo, most likely.